Hello, my people. This is Mwanguzi Shadrach, your doctor from Health Touch Uganda. Today, I'm going to be talking about the two most common types of diabetes mellitus, and that's type 1 and type 2. Remember, I told you that your body uses glucose or the sugars from the food that you eat to produce the energy that you need to do the different activities on a daily basis, and also uses some of this glucose to build your body up. And I also talked about insulin, a hormone produced by the pancreas, or that's produced by your body to help in moving this glucose from the blood to the different parts of the body where it's needed. I also told you that if you have a problem with the way how this insulin works, or you have a problem with the amount of insulin that your body can produce, you end up with an illness called diabetes mellitus, also called high sugar level or high glucose level, or sukari, like people put it in the local language here in Uganda. Now, I'll give you a scenario. Let's think about a construction site where it's fenced and has only one entrance into the site itself. And we have lorries, trucks, very big trucks that keep bringing the raw materials, the sand, the gravel, the cement, the bricks, the wood, and every other thing from wherever. And because they are very big, they are not able to enter through the gate and just offload the raw materials outside the fence. Now we have another set of people that carry wheelbarrows and ferry the raw materials from outside the fence into the construction site. Now, these raw materials are to help the construction process. So everything is needed to keep the construction going on and every other thing move on smoothly. If you have a problem with these guys that carry wheelbarrows, maybe the boss doesn't pay them for a long period of time and they go on a sit-down strike, and they say, no, until you give us our money, for us we are not going to do any other work for you. Remember, you have the lorries bringing on a daily basis. For them, they don't stop. What is going to happen? The raw materials are going to accumulate outside the fence, to the point that they will start blocking the road where people pass. They will start going into other people's land and properties, destroying, causing chaos in the whole community. And in the construction site itself, there is no more construction going on because the raw materials that are supposed to be used are not there. It becomes a problem because these guys have gone on a sit-down strike. That is one type. You might also have the askari who keeps the keys to the gate, lock it, and walks away one day. He says, before you guys pay me my money, for the past 5 months I've not been earning. Before you give me my money, I'm not opening that gate for you. The guys with wheelbarrows are there. They are ready to work. The raw materials are there outside the gate, ready to be taken in. The people inside the construction site are eagerly waiting for these raw materials to continue with the construction. But the askari has locked the gate and he has moved away with the keys. So no construction takes place inside, comes a problem, and still the raw materials will accumulate outside and cause chaos in the community. Things like that. It is the same thing which happens when you eat the food that contains carbohydrates that will later on be converted into the sugars, the glucose. That process of eating, that process is the same as the other trucks bringing raw materials to the construction site outside the fence. Now, when you eat all this, the glucose or the sugars go into the blood. but they have not entered the cells of the body that need to use it or store it. The insulin produced by your pancreas acts as these men with wheelbarrows that ferry the raw materials from outside inside the construction site. So if your body is not able to produce enough insulin, if something happens to your pancreas, it gets damaged and it's not able to produce enough insulin, it means you will not have glucose entering the cells of your body, because it is the insulin which facilitates that process. But now it's not there. The pancreas has been damaged. You don't have enough insulin. So what happens? The glucose will accumulate in the blood and it will start causing other damages. It damages the kidneys and they start complaining. It damages the blood vessels and they start complaining. It damages the heart and the heart starts complaining. It damages the nerves in your feet, hands and eyes and they start complaining. It damages blood vessels in your brain and it starts complaining. Every time a part of your body starts to complain, you present with symptoms which make you feel sick, which make you get admitted to hospital, which might even cost your life. So that's what happens when your glucose accumulates outside, when the insulin is not enough in your body and the facilitation of the entry of glucose into the cells cannot take place as needed. It's something happens because the construction cannot go on. Even you in your body, there are processes which may not go on effectively because you're not producing enough energy. You don't have enough glucose entering the cells of the body. That's scenario number one. When your body becomes resistant to the insulin and the glucose cannot cross through the gates of these cells to enter inside for either storage or utilization, like it happens when the askari locks the gate to the construction site, you will have all the insulin you need to facilitate the entry of glucose, but these channels, the gates to your body are resistant, they are defiant, they have become chaotic. They are saying, no one is entering here. If you die, you die, but no one is entering here. It becomes a problem. You have the glucose, you have the insulin, you need to use everything that's readily available, but the cells are saying no. For us, we are not letting in anything. Of course, there are reasons as to why such things happen, but that is the scenario. That's what happens. Nothing is entering. Those are the two forms of diabetes that are very common in our settings, even worldwide. The first one, also called type 1 diabetes mellitus, is where you don't have enough insulin. Your pancreas has been damaged and it's not able to produce enough insulin. It's also called insulin dependent diabetes mellitus. It is more common in the young people, though it can also take place in the adults. Type 2 is when you have insulin, but your body is resistant to this insulin, so you continue to have a lot of glucose levels even in the presence of insulin. It's also called insulin independent or the adult type of diabetes mellitus because it's more common in the adults, but it can also be found in the younger people, especially these days where we have a lot of risks in the young people that predispose them to getting the type 2 diabetes mellitus. But all in all, you end up with an increased glucose level or high sugar levels in the blood, which damage the different parts of your body. And when you look at these two different things, because one of them is insulin dependent, you get insulin, everything gets sorted. The only problem they have, their body is not able to produce enough insulin. And that's why for those people, when they come to hospital, first we assess and determine which type of diabetes they have, and we start them on insulin. And when we do that, they actually perform so well. And in another category, we just give them medication to swallow. Why? Because it's the other type of diabetes. This medication opens those gates by force. Say, askari, let's cut this padlock and forcefully enter into the gate. So that's what those drugs do. They enhance the ability of the glucose to enter the cells. And when that happens, the glucose levels will be controlled. But in some people, later on, especially the ones with type 2 who are just resistant, they have enough insulin, but the insulin cannot work. Later on, even the amount of the insulin they are able to produce reduce. Because think about it. These guys with wheelbarrows, they come every day to ferry the raw materials from outside the fence into the construction site, but they find the gates closed. They cannot access the construction site. They come today, next day, the other day, next week, and they're like, oh, what are we doing here? Let's just look for other jobs. So they stop coming. So someone who only had one problem of a closed gate ends up with a second problem of not having these guys that carry or ferry the raw materials. And that's when someone ends up with both types of diabetes mellitus. And in such a person, you need to use both the tablets and the insulin, so that when we give you the insulin, we also need to facilitate these gates to open and let in the glucose, like how it happens in normal people. So those are the main types of diabetes mellitus. If you've been told that you have diabetes mellitus or high sugar levels, most likely you have one of them. The good news is we have treatment for all of them. What you need to do is take heed to the treatment guidelines, take heed to the directions we give in as far as handling your life is concerned, eating well is concerned, and all those other things. So in our next episode, we shall be talking about some of the things that you feel in your body, some of the things that put you at risk of getting into this mess. And we shall also be addressing many other issues. Just my advice to you, subscribe to our YouTube channel. Feel free to follow our Facebook page, like our Instagram, like our Twitter, join any of our WhatsApp groups so you can gain direct access to this beautiful information. Remember, you have one life to live. Oh yes, one life to live. Mwanguzi Shadrach, Health Touch Uganda, follow the light.